My name is Barbara Hutchinson, and today I'm talking with Adam Kingsley, a fourth year student at Bristol Dental School and SureSmile patient who was treated by James Taylor at The Dentist in Leeds. As both a patient and an aspiring dentist, Adam has a unique perspective on aligners, so I asked him a little about his experience of this treatment. As a dental student, you're in quite a unique position as a SureSmile patient. So tell the listeners a little bit about your background, about how you got into dentistry, about what kind of led you to become a patient for SureSmile.
Actually, I've always wanted to do dentistry, if I'm being honest. My grandpa was a dentist, so I've always had the exposure through him growing up as a kid, spending the weekends with him, meeting lots of different patients. So I've really had that full exposure. And I think with dentistry, it's one of those things, unless you've been treated, you've had braces as a child, you had some issues when you were younger, and then you go into the dentist regularly, you don't have that full exposure. So it's quite interesting on our course. A lot of people have that sort of connection, whether it's through family or they had braces as children, they get that exposure through that. So I've always had that interest and that willingness to do dentistry, and here I am doing it today.
Could you just explain a little bit of background about your case? Did you have also as a child and this has relapsed, or did you just come to it, and was that a pre-pandemic thing, a pandemic thing, looking at yourself on Zoom? How did it come about that you wanted to have aligner treatment?
So with me, I was always on that border of, did I need it or did I not need it? And with my grandpa, when he was treating his family, or you just sat at dinner and I was like, do you think I should get braces? It would always be, it's so fine, it's absolutely fine, it's no problem, you don't need them. And then lockdown came, and I thought, actually, you know what? I'm third year dental student. I can see what the problems are physically and technically speaking as well. I want to improve the aesthetics slightly. I want to improve things like my occlusion, the way my teeth are biting, my lip fullness, and I can see that. I can see that textbook improvement can be made. So I thought, why not do it? And I got in touch with Dr. Taylor through highly recommended one of my friends. I was actually away in Spain during the whole pandemic, and we managed to get away. And she said, I'm actually having the treatments at the moment. So I thought, fantastic, I'm going to just go for it. And you've got so many dentists and lots of different treatment options. And I just thought, I've been highly recommended to James. Let's just do it. I've been wanting to do this for a while now. I'm just going to go ahead and do it.
When you actually got to the practice, were you aware of SureSmile as a treatment, or did you literally go and say, I want orthodontics, or did you want clear aligner treatment, or did you want some sort of digital ortho? What was kind of your?
So I always knew I didn't want your conventional braces. I think I was past that point in my life. I knew I was doing dentistry. I didn't want to have that, full on train tracks with patients and have the difficulty with changing the wires and all that kind of thing that you have to do. So I knew that clear aligners were an option for me. I wasn't entirely aware of SureSmile, but when James made me aware of the options there, then it did really seem nice, and we went ahead with it.
Was there something specific that convinced you about SureSmile? Was there an element that James kind of explained about the treatment, or was it literally just it was just he said, okay, we do SureSmile here, so if you want clear aligners, this is what we do?
No, I mean, James always gave me the full breadth of option. We discussed through the pros and cons of each thing. With SureSmile, what was quite nice is, one, it's a properly clear aligner. With some of the other brands, you've got the lines of where it's been printed, so it's not entirely clear. And for me, I'm a bit of a perfectionist with stuff like that. I wanted it to be as close to my own teeth as possible, and SureSmile gave me that opportunity, and so I went ahead with it.
Okay, so did he show you some examples of the aligners? Or?
Yeah, we looked through both of them, and what was fantastic with James, we were able to do the treatment together almost. We sat there, we did the digital scan of my teeth, and we actually were able to customize that. Again, SureSmile gave me that opportunity to sit on a video call with James and say, actually, I want it to be slightly different. I want that tooth to be a bit more proclined. I want it to be a bit further out than it is at the moment. And we were able to work together and come up with a customized treatment plan. And I don't think the competitors give you that opportunity.
So I understand that within the SureSmile software, you're able to obviously see your dentition on screen, and then the before and after the transformation.
Exactly. So that's when I was like, oh my God, I'm so pleased I've done this, because it's until you actually see that physical change, you don't realize, wow, it can make a huge difference. You know, James had explained to me, we're going to get lip fullness. We're going to really see a big difference. You're going to get the light shining on your teeth a lot more. And overall, you're going to get a fuller smile. And that's what everyone strives for now, to see that 6 to 6 or 8 to 7 to 7. You know, you get that big smile. It doesn't look fake. It's not that kind of Hollywood look, but at the same time, it's super natural, and you're getting a nice big white smile. And that's what I've always wanted. And until we saw that change of before and after, I was like, wow, this is, I'm going to see the difference here. I'm going to definitely go ahead with this.
So did that like really bring it to life? Is it very realistic when you see it on the screen?
Yeah, it couldn't be more realistic. It's like you literally, with a click of a button, you see that transformation of, this is what I'm going to look like in 6 months. It's just quite unbelievable. I really couldn't believe it. And that moment together with James was amazing, to say, this is what we're capable of. And this is absolutely achievable.
So I wonder, does he get that reaction then from a lot of patients? He kind of presses the button and they all go, oh, wow, yeah, sign me up.
I think that's one of the special things about dentistry, one of the reasons why I wanted to do it. With dentistry, you are able to, you stay in contact with your patient the whole way through. At times I was torn between medicine and dentistry, and I was like, you know what, dentistry, you get to live the transformation with the patient. And that is that special relationship that we get to have. And that's what I saw. And it was quite nice to be on the other side of it this time, with James experiencing that as well. So we got to experience that together, which was lovely.
And so what were the first stages of treatment? And from a patient's perspective, what did that digital workflow feel like? Because we talk a lot about the digital workflow, but kind of you're seeing it from both the clinical and the patient side. So what were your experiences of that?
So I think what's fantastic is, straight away, you know, he's got that digital scanner in the room. So you're able to do the impression there and then. And immediately it comes up on the screen, which is, you know, such a fantastic experience for the patient and the dentist as well, to see how far we've come with this sort of technology. It doesn't require the impression in the mouth. It doesn't require that horrible material that a lot of people don't like the taste of. It goes down your throat and all that kind of thing. So we scanned my teeth, the full dentition first of all. And once that scan has been done, James then worked with SureSmile to come up with, what are the options that we've got here? So once that had been done, James still has the ability to customize what SureSmile recommend for me. So that's what I found quite special. So they said, this is what we would do. But James then had the opportunity to say, actually, I want to move that slightly to the left. I want to move that just a mil here, mil there, customize it for the best possible outcome for Adam. So it wasn't like, you know, I know a lot of the competitors, you can send off a thing, they send you an impression material in the post, you send it off, they say this is what you're getting. With this experience, we were able to customize it together, and it felt a lot more personalized than what I see with the others.
Okay, so you really felt as if you were part of the
experience and part of the journey, for sure.
So and the digitization, that made a big difference. They're not having to have conventional impressions?
Not having to have the conventional impressions. One, it's more comfortable for the patient, and it was more comfortable for me. But also, it's that accuracy. You know, it is a physical image. It's scanning each and every minuscule surface and detail of every single tooth. And with orthodontics and occlusion, so how the teeth are biting, that impression is crucial for the end result. And that's what we're able to achieve with the scan.
Sure. And what particular aspects of the treatment were you most impressed with? You've talked about the wow factor at the beginning when you saw that thing, and the intraoral scan that you had. Sure. Was there a particular thing that you thought worked really well, or just the whole thing together?
The whole thing together, but also I very much like the lip fullness that I got from this. I think that's something that a lot of patients forget about. Actually, your teeth make a huge impact on your overall facial structure. I've had a couple of patients, when they lose teeth in the mouth, it depresses the mouth because you get bone regression and bone loss in that area. But similarly, if your teeth are proclined, retroclined, going to the back, which mine were, you lose that lip fullness. So with James, we discussed, actually, when we're going to move these teeth out of it, you're going to get lip fullness, you're going to get overall face fullness, and it makes you look a bit healthier, and it makes everything look a bit nicer. So I was excited for that result as well.
And what have you learned from the way in which James approached the aligner treatment that you think might help you in the future in your own clinical practice? Was there some bits that you thought, oh yeah, he's really done that well?
So from the beginning, James was really good at explaining options. I think options are key in dentistry. Dentistry is no longer, this is what we're doing, and this is your only option. Dentistry is a massive breadth of options. And it's really important to give the patients that opportunity to understand the pros and cons of each treatment plan, to understand that they are ultimately the decision maker here. So James was really good, and I like the way that James did that and say, let's just sit down. This is a conversation. There's no pressure here. And ultimately, if you don't want to go ahead with anything, that's fine. If you want to go ahead with SureSmile, that's great. If you want to go ahead with some of the competitors, that's no problem either. So I really felt comfortable in the fact that I knew what James wanted for me, but at the same time, he was giving me the option as well, that if I did want to go with anything else, he was fully behind me and supportive of that.
So, and has the experience of being a patient through aligner treatment, has that made you think any differently about the way in which you might talk to patients and explain treatments to them in the future?
Yeah, I definitely think so. And I think you pick up these things subconsciously as well. So just the way his relationship with the nurse, that was big for me. You don't realise that kind of thing. They know that, they've got such a tight way of working that the nurse knows that James needs a bit of aspiration, or James might need decuring light then and there. There isn't a discussion, whereas I might have to say, can I have the mirror, or can I have something? The nurse knows straight away what do they need. And it's building that relationship together that you actually get non-verbal communication. So it just flows so nicely in the practice.
Have you come to appreciate that more then? Was that kind of quite illuminating for you that you thought, I need to work at that in the future?
Work on that. And having that relationship with your nurse is crucial because it makes everything much more comfortable for the patient. It's not nice to hear, can you pass the needle over before an injection? No one wants to hear that. So it's building that relationship with your nurse so that is this the most comfortable possible experience for the patient? And James really, passed that on beautifully.
Overall, how happy are you with the results of your SureSmile treatment? Has it met your expectations? Did it exceed them? Is there anything that you wish you'd asked for that?
Sure. I mean, for me, it's just been amazing. It's met and fully exceeded my expectations. And I think what was really interesting for me, and when I knew I'd made the right decision, was when I went to go and show my grandpa. And he said, wow, I'm so pleased you actually did it. And for years, my grandpa has told me, you don't need it. It's a healthy mouth, healthy teeth. You don't need braces. To hear him say, wow, what a difference. That was when it sunk in to say, you know what, I'm so pleased that I've done this. And I'm so pleased with the result as well.
And how long did treatment take?
Treatment took about 5 months altogether. So it wasn't a long time. And actually, it was the perfect timing. Lockdown came and I just started. So it was kind of like life went on hold for a bit and I was able to come into the dental school with my new set of teeth. It was amazing, actually.
Has it increased your interest in orthodontics and digital dentistry?
100%. What I really liked about it is how involved the patient is with the treatment. With a lot of dentistry, you're there, you've got your safety goggles on, your bib, you've got a shining bright light in your eyes. You can't really see what's going on. And obviously you're checking that the patient's comfortable throughout the treatment, but they're not involved in the treatment once you've signed off and consented and we've decided what we're going to do together. Whereas with this, you're putting in what is a physical dental device in your mouth every single day for 22 hours, if you can do. And actually what I found really nice was with SureSmile, you've got to have a couple of composite add-ons on a couple of teeth. And it gives you constant feedback because if the aligner is fitting over those composite add-ons, it's fitting and it's working. So you're getting constant feedback from the aligners and I'm able to say to James, yeah, it's fitting nicely over all the teeth. It's clicking on, my occlusion's still looking good. And that was good for me because I could get that instant feedback. I knew it was good and I could report back to James and he said, yeah, you're great to move on to the next aligner. And so ortho particularly with the clear aligners, you're working together with the patient. The feedback from the patient is just as important as moving on to the next aligner, or just as important as that initial impression or whatever. And that this really gives you the opportunity to work closely with the patient and form that relationship.
And were the aligners comfortable to wear?
So I'll be honest, the first, when you change the aligner, that's when it was a bit tight. It's not uncomfortable, it's not painful, you're just aware that there's a bit of pressure. Now for me, I know you've got a lot of support around the tooth, you've got huge amounts of innervation, nerve innervation, blood vessel innervation, and we have what's called the periodontal ligament, which supports the tooth in the bone. So obviously when we move them, everything's fighting back to say, no, I don't want to be moved. I'm happy where I am, and the tooth doesn't want to be moved. So when we place a clear aligner on it, it is going to be a bit uncomfortable for the first day, but once it settles into the new position, then everything, it's not hard to wear for the rest of it.
They're very well fitting, the aligners. You can tell when you've got them on that they're
you know exactly. Yeah, I'm ready to move on. It's quite interesting because in a week's time, an aligner that was really tight and putting on the first time becomes almost easy to flick straight in and out. And you're like, wow, I mean, in 1 week's time, I've actually seen a physical movement of my teeth. So that's when you're like, I can see the progression already. And I'll be honest, when I first got all my aligners, because I did it from Bristol, so James gave me a large set of aligners. I did skip to the last one to have a quick look at what it was going to look like. I was really excited to see. And it's amazing because it doesn't fit in. And I thought, I'm going to just try to see if it fits in. Of course it doesn't fit in, but it's amazing to see that this is what my teeth are going to be. And currently it doesn't fit, but in a 6 month, 4 months time, I'm going to be able to fit into that. And that is going to be my teeth, which is quite amazing to see.
I wonder how many other people do that.
Not many, I don't think.
I know that you kind of decided what you wanted right at the very beginning, but I understand, because James has told me about this, about being able to do kind of mid-treatment refinement. Did he do any of that with you, or did you literally go from start to finish in the planned treatment the way it had been planned at the start?
So I think because we'd worked so closely at the beginning with this is what the final result is going to look like, I was happy to stick with it and we didn't need to do any alterations. But I was comfortable in the knowledge that if we did, that was available at any point.
Do you think that clear aligners is something that you'd be interested in doing yourself when you graduate and you're finally in practice?
Yeah, I'm quite excited at the prospect of clear aligners when it comes to practice, particularly because it doesn't need to be the only thing you do. With clear aligners, it can just be a part of the treatment that you offer in your practice. And that is what James does. So he's got a really exciting day. So one patient might be scanning, doing that initial impression, and wow, let's see the final result. And what an amazing thing to share with the patient. And the next thing might be doing root canal treatment, or even at James's practice, fitting an implant. So clear aligners is not the only thing that the dentists have to offer. It can just form one of those treatments within a practice, which I find really exciting and just provide something new to your day, I guess.
Things are moving so quickly in the area of digital dentistry. Who knows what things will look like in another couple of years.
Exactly. I think if we went back even 5 years, we just wouldn't be having this conversation. So it's so exciting to be involved in this sort of industry. Dentistry as a whole has moved on hugely in the past 10 years. So to think about what it's going to be in 10 years from now is hugely exciting and something I'm super interested to be involved in.
Thanks to Adam for his time, and we'd like to wish him all the best in his studies and future career. If you'd like to learn more about incorporating SureSmile aligners into your practice, please visit www.dentsupplyserona.com/SureSmile and book a no obligation consultation.